the whole system, there is very little financial incentive for you to stay better, to stay well. There's the way you feel, but financially there's very little. What can be done about that?
Well, let's take obesity, for example. Yeah. Obesity now accounts for 10% of the cost of health care in the United States. And we will never be able to control the cost of health care in the United States till we begin to control the epidemic of obesity. 2/3 of the United States is overweight, and 1/3 of the United States is obese. And it is going, and we are the fattest nation in the world. Our rate of obesity is going up, so that we're going to have probably half of the United States being obese in the next 20 years. We have to do something about that, and there are plenty of things that we can do to make things better.
Well, there ought to be, because if ever there was something that ought to be controllable, it's that. So what can be done?
Well, I think you have to start locally, like most things. And industry, for example, has got a tremendous opportunity to do things. One of the things that we've done across the Cleveland Clinic is we've said, look, we need to give our employees and our patients the right foods. Right. So we took trans fats out, just like we did here in New York City, of all of our foods. We took the fryers out of all our cafeterias. We took the candy bars out. We took the pop out of the vending machines. And then we turned around and said, let's work on the other end of it. Let's let people get exercise. Right. So we gave free curves, free Weight Watchers, free access to our gyms, pedometers to our employees. In the first year, they lost 120,000 pounds. That's fabulous.
That's a lot of fat that has disappeared.
Yeah, but we got a long ways to go.
We got a long ways to go. Well, let's pursue that for a second, because it would seem to be so obvious. What you found was that you were able to achieve something, right?
Absolutely.
They really did lose weight.
Absolutely.
So why aren't more companies doing what you're doing?
Well, I think it's been always a question of what's the ROI on this?
Right.
And until very recently, people didn't realize the ROI is about 3 to 1. For every dollar invested, you get 3 back in terms of employees being better. Let me tell you what we did in smoking. This will be a surprise to you. We said no smoking on our campus. Right. Then we gave everybody free smoking cessation. Right. Then we went out and we lobbied hard for smoking cessation in the state of Ohio, which in public places, which got passed. Right. Then we offered free smoking cessation to everybody in Cuyahoga County where the Cleveland Clinic is. Right. Then we stopped hiring smokers.
Right.
And you know what happened? In 4 years, the smoking rate in Cuyahoga County went from 28% to 18%. And the country's average is 20%.
Yeah.
So you can make a difference.
That's amazing. I mean, that's an amazing result. Now, you stopped hiring smokers. This is the part that's, that's really where the rubber meets the road. You stopped hiring smokers, and if I have read this properly, sometimes people get tested.
Yes, they do. We test all new employees for nicotine as well as drugs as part of their employment physical.
Right, right.
And, it's very interesting what you can do with that sort of thing, and it's